It is Tuesday, February 9th. Watkanurados Owego, Joe Delaro New Jets. Welcome to the Kahnawake COVID-19 Task Force Facebook Live update. This is our 175th update. I still find that hard to believe, and we're only doing them twice a week these days. A big program today. We have lots to get to, so we won't waste any more time with pleasantries. Let's get right down to it. During the pandemic, one of the things that we've noticed is that people have been doing different things to take care of their health, their mental health, and also they have time to do some of these things, such as artwork. Today we'll talk to a couple of young ladies who have some programs that are underway. Adrienne Zachary is with Kanerahtenhà Community Services, and Megan Kanerahtenhà Whyte is also an art therapist, and they will talk to us today about what they have going on and some interesting things. We'll start with you, Megan. Give us an idea. I see your paintings around town. I used to see them at the Water Drum all the time. Not the Water Drum, but the pizza joint. And let's talk about artwork, what you do, and what kind of inspiration you're hoping to bring to the community.
Yeah, Joe, for introducing us. So for those who may not know, my name is Megan Kanerahtenhà Whyte. I'm an artist and art therapist in the community. And I'm here today with my co-facilitator, Adrian, to promote the Kahnawke Art Hive. So I'll explain a little bit about what this initiative is, but it is aimed to youth ages 12 to 18. And my role this afternoon is to explain what an art hive is, how we can access it, and a little bit about its potential impact for youth in our community. So a little bit about myself. I work in the mental health field supporting children and youth and families in creative arts therapies. So in this role, I have the pleasure and really the honor to witness the impact art has on people. And especially when we start to shed those layers of I'm not an artist and I don't like art and I'm not very good at it and I can only make stick people. So in that same spirit, to talk a little bit about what an art hive is, at its foundation, it's a community art studio that welcomes everyone as an artist. So no experience is needed, no skills are needed, and definitely all stick people are welcome. So an art hive can look like so many different things. It can be a pop-up studio space. So this could happen in a classroom. This could happen in a boardroom. This can happen online. This can happen in a garden. It can happen anywhere, because at its heart, an art hive is all about inclusion. It's about respect. It's about learning. And I think looking at its name, it's kind of like a beehive in a way. An art hive is a place where we network and we feel connected through creation and we build something together. So for me, an art hive is a welcoming place to talk. We can make art, we can build communities, we can respond in creative ways to things that really matter to us. And I think as an artist and an art therapist, in making art, we can learn so many surprising things about ourselves. We can learn about what nourishes us when we make art. We can learn about our needs. We can learn about how we talk to others or how we ask for help when we need to create something. We also learn about boundaries and we learn about limits from the messes we make. Like literally, because art can be messy, but also metaphorically because life is a little bit messy too, especially now. So I think like at this time, we're 11 months into the pandemic, isolation and lockdowns I think are weighing down on a lot of us. And we actually might feel more tired and stressed for what feels like no reason. And I think a part of that reason, on top of many other reasons, is because we're social beings at the core and we need that connection. And I think what a lot of us are feeling are disconnection, and sometimes it feels like a fog, like we're just in this fog. I think we're missing a lot of those networks that we normally rely on and those people and those ways of being that we don't have access to. And I think that creates its own stress. And I think about our young people, which is what this art hive at this point in time is targeted to. Isolation can be so challenging because at this point in time, this is where they're exploring autonomy, being their own person, identity, their relationships and friendships, their mark in the world. And they're learning about how to make decisions and how to cope with how that makes them feel. And I think Aishin can impact these really normal experiences and can make our young people feel all kinds of things. They might feel stuck and helpless and annoyed. They might have low energy. They might feel some bouts of depression or anxiety. And I think many also feel that way too. So for me, the aim of an art hive is hopefully to create a place where youth can gather, they can explore. It can be a place to learn art methods that can support us and kind of normalize everything that we're feeling so that we're not stressed all on our own. But it doesn't always have to be serious. Art making can really be a place where we can relax and feel delight and play and explore and experiment with other people. And really at its core, it's like a peer-led experience. So I think what I want to emphasize is that this isn't necessarily therapy. It's not group therapy. But I think art can be therapeutic in itself. And our role and I is to support these young people in the projects and themes that they may do. So they can lead their own discussions and guide the projects. And our role is really to walk with them on this journey and that to emphasize that this is for everyone and anyone who's interested in just meeting new people and just creating new projects and just seeing what can happen. So if anybody has a young person that might be interested, they can definitely come and contact myself or Adrian for the Zoom link, or if you have any questions or you want to know a little bit about what it's about, you can reach me by email, which is mkwarttherapy@gmail.com. You can also follow us on Facebook and Instagram with the social media handle at Kahnawake_Art Hive. So a little bit of logistical things. So our meeting time is every Sunday from 4 to 5 on Zoom until March 28th for now. It's free, it's peer-led, it's accessible, it's a drop-in style. So youth have the autonomy to choose how many times they'd like to come, if they want to come once or every time. And if there's any materials that they might need that they might not have or they're interested in trying, Adrian and I can prepare some art kits that they can have at home. And I think just to remember that art is for everyone because creativity is really about connecting to ourselves, is connecting to spirit, is connecting to each other. And I think feel in this fog a lot of times in this pandemic. So I think when we use our hands in a very physical way, our bodies in a physical way, we can ground ourselves in really surprising ways.
All right, I can tell you the poster is very creative in itself. Adrienne, let's talk to you about your role in all of this. I know it's for all of the excitement, there's only an hour a week. Is that enough?
Sometimes it's not, no. Again, just to reiterate what Megan said, we're really working with a lot of different art mediums. So not everybody working on a painting or a sketch. There's some who may be working on digital art, some are painting, some may even prefer to write. And we have the conversation flowing and it can be very light. We could be talking about, pets, or maybe somebody has a concern and they want to talk about it. But it just flies by within an hour. There's a lot of laughs. It's a lot of fun.
Mm-hmm. What are some of the things specifically that draw you to this?
I'm sorry, there was a little bit of a cutout.
Oh, sorry. Okay, I'll ask again. What is it that draws you to do this type of work?
Well, I'm a primary prevention worker at KSCS, and my main role is facilitating the teen group, which is not running right now because of the pandemic. But I'm used to working with this age group, 12 to 17, and I love this age group. I love the conversations we have. I love the activities we do, the volunteering, just everything we've done. That's really important to me, and I really enjoy working with this age group. So I'm having a lot of fun just creating art, and I'm having a lot of fun having conversation. It's something that I miss doing in person, and I hope that we can get back to that soon.
I think we all do. So it's a great program. I really love the idea of it. We'd like to thank you for joining us this afternoon. The contact information is there, and anybody who's watching, you see the posters around town. Just a great idea, and as Megan said, we are social animals, not only the adults, but the young people as well. And I think for younger people, some of them have a more difficult time because they're so used to being in school with 30 people in their classroom. So this is helping out a little bit, and art, again, is its own reward in many ways. Thank you both for being here.
Nyawa.
Okay,
Nyawa.
Kahnawake. Joining us next to talk to the community and bringing you hopefully some words of inspiration from the Mohawk Council of Kahnawake, and he's also a member of the COVID-19 task force. Here is our Ratsénhaienhs, Lloyd Phillips. Lloyd?
Thank you, Joe. Good evening, everybody. It's been maybe 4 or 6 weeks since I've been with you last through this medium. I'd just like to say hello and hope everybody's faring well and doing everything that you possibly can to safeguard you and your household. I guess maybe at this point I just wanted to take a few minutes, very few minutes of your time. And, you know, we're here at the Kahnawake Peacekeeper Station. I guess it's Ground Zero, what I call Ground Zero. I know there's other names for it, but it's the central headquarters for the COVID task force. And there's a lot of going on here all the time. It's a very much a lot of work being conducted here. There's a lot of, you know, we have been mentioning a lot of times that there's, you know, thanks to the task force for everything they're doing. The people within this building who are helping, you know, Kahnawake, I guess, progress through this COVID epidemic, pandemic rather, that is gripping the world. Unfortunately, you know, all of our brothers and sisters and sister communities are not faring as well as we are here. I did have a update with the Iroquois Caucus on last Friday, and sadly, you know, not every community is doing as well as we are, and I guess largely to you know, to I guess Kahnawake's efforts. Our numbers of 0 hospitalization and 0 deaths are, you know, what counts, what matters. And we're extremely lucky that we are at that level. So right now, I just want to take time to, of course, you know, we always thank the task force for their hard labor. We thank our scientific people who are doing all the research and the studying and coming up with the recommendations that we offer you to safeguard you and your loved ones and the community. But right now, I want to talk to yous. Everybody at home who's doing everything possible, you need to be applauded. You need to have that pat on your back, because without your help, without your buy-in, we would not be where we are today. You know, COVID is gripping the world. We see it, we hear it. And in Kahnawake, we are on firm ground. There's still a lot more work to do. There's a lot more mileage for us to have to travel. You know, people are saying there is a light at the end of the tunnel, but that tunnel is a very lengthy tunnel. So today, my purpose for being in front of you this evening is to just say congratulations, Kahnawake. Every single one of you who is doing everything humanly possible to make a difference, you are making a difference. There's, you know, unfortunately, some people may choose not to follow our recommendations and, you know, do otherwise. Well, you know, I have my opinion, you have your opinion of these people, and you know what? Let's not let that affect us in what we do, what we need to do, what we need to do to ensure our elders and our babies, you know, are going to come out of this well. I won't take much more of your time. That was just a message that I need to deliver to you from my heart, to say that we applaud you, I applaud you, and keep up the great work. What yous are doing is helping us keep this community safer. So that's all I have to say on that issue. But before I leave you, I just would like to say on behalf of myself and the Mohawk Council of Kahnawake, Council of Chiefs, I'd like to acknowledge and congratulate Honorable Carly Marquis on becoming the new Executive Director of the Mohawk Council of Kahnawake. Congratulations, Carly. You really did well. You deserve this, and I look forward to spending as much time as I have left with the Mohawk Council of Kahnawake with you at the helm at the administrative offices at the MCK. Now, everybody.
Thank you so much, Clinton. And I'd like to add my congratulations and best of luck to Kanerahtenhà as well. Joining us at this time is Lisa Westaway from the Kahnawake Memorial Hospital Center. She's got some updates for us on today's Kahnawake 911. Lisa.
Thank you. I wanted to give an update regarding the outbreak that we announced over the weekend at Step by Step. I spoke a little bit about it on the radio on K103, so this is essentially a repeat. Just to say that all are doing well. The children are in isolation until the 16th inclusively, as well as a family member. The important message that I wanted to give today to the community is that we have to be really careful about our judgments about this specific situation. You may see family members within the same household of that child who are walking around or going to work. Every single family has a different scenario, a different situation. All of these families have spoken with public health. We do appreciate that you're looking out for the community. However, we have released from isolation some people. So it's just important to know that every single family has a different scenario. What some of the measures that have been taken, there have been complete contact tracing that has taken place. All of the children, the educators, as well as, or have all been screened or tested if anyone has had symptoms. And we continue to follow this case very closely and are working very closely with Natalie and the Step by Step team, who are very involved in the measures and changes to be implemented as we move forward. Next, I wanted to mention statistics. So as we had said last week, we will weekly be providing you with updated statistics regarding the testing site and regarding positive cases. So we can pull up the first chart. So as we see here, we have completed a total of 3,376 tests. That's an additional 503 tests since the last time we presented these results to you. That was on January 28th. And we have an additional 8 positive results. As of today, we actually have 5 active cases. So 8 positive since January 28th, but only 5 are active at this time. So we're at a total of 84 cases in the second wave. And I guess that's several negative results as well, which is important. 3,270 negative results, 495 additional since we last presented results to you. So if we look at the breakdown by age group, the numbers are much larger, so it might be easier. Oh, they switched the chart. Okay, so it might be easier for you to see. So for males, 48 positives, female 58. And again, we see that the 50 to 59 age group are our highest number of positives. What I think is really, really great, and just to continue on the applause of the community and protecting our elders, we have very, very few people in the 70 and up age category who have tested positive for COVID-19, and that really demonstrates how, as a community, we are protecting our elders. So congratulations on that. We also, so our numbers quite well demonstrate how protective we've been. So that's very good. The next chart, just to demonstrate, is where we've done the most amount of testing, and that's in January. Just a small point to add here is that we have actually screened our employees on a weekly basis, both at KMHC Inpatient, Elders Lodge, and ILC. So those numbers are included in the chart. So that inflates the numbers a little bit. And eventually we may be able to separate those numbers. However, it's just important to note that that has been taking place since the end of December and early January, and will continue until next week. So these are the amount of tests that were performed by month since March, since we opened the testing site in March. So one thing we're doing in preparation for vaccines. So I'll give you first an update regarding the vaccination process. So again, we still confirm that we will vaccinate either all 16 and up or all 17 and up from the community by March 31st. We are still awaiting vaccine, and this is not a political issue. This is a problem in all of Canada. We have not received very many vaccines. There is a shortage at the present time as companies are ramping up production. We expect deliveries to resume next week, and therefore we should get more information in the coming weeks regarding the exact dates for vaccination and how to book your appointments. However, we still have confirmation that vaccination will take place before March 31st for our community, which is well above and sooner than anywhere else across the province. As you know, Indigenous communities have been prioritized in Priority 4. However, we are, the communications team has worked really, really hard in getting together a vaccination site to be able, website to be able to provide you with up-to-date information as we move forward. So that website is kahnawake911.com/vaccine. So please feel free. I believe it's active as we speak. Dr. Gauthier's frequently asked questions are there, and as we get more information, we will continue to populate that website. There are some videos there that are pretty interesting and pertinent, and we feel that this is the place to go with the most accurate and detailed information. So we urge you to get your vaccine information from this website. One last mention is that KMHC is doing a special Sunday drop-off this Sunday, the 14th, for Valentine's Day. So if you do want to drop something off for a loved one between 10 and 1, we will be open, and we thank you very much.
Thank you, Lisa. You were a little quicker than I expected there. All right, as promised, I said it was a busy program today, and joining us to finish up the program is Lloyd Phillips, who of course is the head of the COVID-19 task force. Lloyd.
Thank you very much, Joe. Thank you, Lisa, for that information, as well as to Clinton for your words. I appreciate all the support that we can get from the community, and as well as the workers from KSCS who presented a project, I think, which is very good, for support the community as a whole, and something different, something unique, something I think anybody can participate in. I think it would be something we should all look at as a means to express yourself, and as well as to deal with some of the pressing mental health concerns and issues that are at play in the entire world, for that matter, because it is again long and drawn out for the past nearly 11 months now. But what I want to talk about is a couple of quick points. As you may be watching the news today, with the 826 cases confirmed in Quebec, certainly it's on a downward trend, which again is positive. This wasn't very long ago. We were looking at numbers in 3,000 and then in 2,000. So now it's gradually dropping, and you see 800 is still quite high. It's still alarming, but much better than it was just several weeks ago. So that's testament to all the work that's been happening, throughout the province. But obviously, specifically within Kahnawake, we have our numbers are very low. They have been manageable for the past several weeks, and that's the way we certainly want to keep. We want to keep it that way. Also in the news, you've been hearing probably a lot about the new variants of COVID-19. There's a lot of talk of UK variant, South African variant, Brazilian variant. We're certainly going to have more information on that in next week, when we have more medical expertise on that. But I just want to reassure the community that obviously we are watching that very closely. Looking behind the headlines, it's one thing to look at the news and have a 2-minute story, but we have Dr. Gauthier to look at the real science behind what that really means and how do we best approach it, how do we best address it and take proper measures to keep ourselves as safe as we possibly can. But one thing that is certainly for sure, I mean, the whole notion, of distance, mask, and hygiene are still the cornerstone of what we need to do. And as long as we keep that up, we are going to be on the right track. And if things need to change in the coming days and weeks, and obviously, we will keep you up to date on that. But again, like I said, I just want to reassure the community that we are following that very closely. On a final note, as we all know, this past weekend, Sunday was Super Bowl Sunday. And whether you like Tom Brady or you like the Chiefs, that's your decision. But I certainly like the fact that the community was respectful of the measures. There was no reports to the peacekeepers or any other place about gatherings, about parties. So people were very respectful. People understood the situation that we were in. And it's one more event that's in the history books under COVID, and hopefully, next year this time and coming months, we'll have that sense of normalcy where we could have, those gatherings, we can have those parties, and we could, enjoy the activities we enjoyed before. So again, congratulations to all Kahnawake. Thank you for abiding by the measures for Super Bowl Sunday. With that, I'll turn it back to Joe, and I'll see you again soon. Onigiwahe.
Now, Lloyd, just before we leave, I just wanted to mention one thing again. I thought what Lisa said was very, very important, and it's kind of been lost through all of the activities and news reports throughout the last 10, 11 months now. But yes, we have had cases, but the fact that there have been practically none in the age group that we've been most concerned about is, to me, the best news I've heard in a long time. That means we really are effective. People will still contract COVID-19, but we've managed to keep it away from that most vulnerable population. So congratulations to you. That's all of us, actually. So with that, I just wanted to mention that coming up on Thursday's program, we'll have a special nice little report on beating in Kahnawake, as we know that a lot of people have a lot of time on their hands, and they've been doing a lot of good things, and some of them are culturally very relevant, such as going back to beading, and along with painting and all these other nice things. So we'll have a report on that coming up on Thursday, and of course a whole new program for you with some other guests lined up. With that, I'd like to say on behalf of all of us here, be safe, be smart, be responsible, and we shall see you next time. Take care. Onigiwahi, Dano.